Hello everyone. For my signature assignment, I chose vitamin B12. Chemical structure. The chemical formula for vitamin B12 is carbon 63, hydrogen 88, cobalt 13, nitrogen 13, oxygen 14, and phosphorus. The molar mass is approximately 1,355.4 grams per mole. Vitamin B12 has a complex structure that consists of several key components that consist of corrin ring, cobalt ion, upper ligand, and side chains. The elements included in vitamin B12 are carbon, hydrogen, nitrogen, oxygen, phosphorus, and cobalt. This molecule has several bonds, and those are coordinate bonds, covalent bonds, ionic bonds, and hydrogen bonds. This molecule is polar because of the functioning groups it is associated with, which are amino groups, hydroxyl groups, phosphate groups, and cyanide. Function and metabolism. The function of vitamin B12 in the human body is practical for the production of red blood cells that help carry oxygen in the body. It also helps with the brain functions like memory and mood regulation. Vitamin B12 is not produced in specific cells in the body. Humans get vitamin B12 by taking dietary supplements in order to have the helpful effects of this molecule. Vitamin B12 is involved in two metabolic processes. These two processes are methionine synthesis and methylmalonyl-CoA metabolism. The enzyme involved with methionine synthesis is methionine synthase. Disease state when too much. The approximate amount of vitamin B12 circulating through the body can depend on different things like overall health and age. A normal range for vitamin B12 levels in the blood is about 200 to 900 picograms per milliliter. If there is a consistent level of 1,000 picograms per milliliter or higher, it is considered a risk factor. When there's too much vitamin B12 circulating in the body, it doesn't really cause severe symptoms, but in some rare cases, it can cause digestive problems, skin issues, and neurological symptoms. Disease state when too little. Vitamin B12 deficiency is typically diagnosed based on blood levels of the vitamin. A level of below 200 picograms per milliliter is often considered deficient and may indicate vitamin B12 deficiency. Some symptoms of vitamin B12 deficiency are fatigue and weakness, pale skin, shortness of breath, dizziness, and cognitive issues. If B12 deficiency is suspected, a doctor will typically perform a blood test to check levels. Diagnosis and treatment. Vitamin B12 deficiency is diagnosed through a combination of medical history, laboratory tests, and physical examinations. Typically, when looking at medical history, the doctor will ask you if you have any symptoms that indicate you have vitamin B12 deficiency. During a physical examination, the doctor will check for pale or yellowish skin, a smooth tongue, or any signs of nerve damage. When it comes to a blood test, they could do complete blood count, which helps detect anemia, red blood cells that are bigger than normal, which is a common sign of vitamin B12 deficiency. If you would like to treat B12 deficiency, you will have to take some dietary changes and take supplements and monitor as much as you can. There are over-the-counter vitamin B12 supplements that are prescribed for mild to moderate deficiency. Some dietary changes you can make are eating rich foods or going on a vegan/vegetarian diet. Some rich foods include meat, fish, eggs, and dairy. The chemistry of medications used for vitamin B12 involves various forms of the vitamin, both natural and synthetic. The synthetic form of vitamin B12 are used to replace natural B12 in the body, particularly when dietary intake or absorption is insufficient. The way medication is administered is that people with a mild B12 deficiency often take oral supplements, which are available in the forms of tablet or chewable forms. These can be taken daily or as prescribed. Oral supplements may take longer to fix a deficiency, usually several weeks to a few months. And this is my resources page. Thank you so much for listening.